Good afternoon. My name is Deborah Lancaster. I'm the Global Head of Strategy and Growth for the Diabetes Care Division within Roche Diagnostics. And I'm here to speak to you today about the intersection of patient centricity, digital innovations, and health inequalities. And I think it's important to start with that introduction because I come from a different paradigm. I come from medtech, and I come from a disease, diabetes management. But while I come from those two perspectives, the challenges I see as they relate to health inequalities, the solutions out there for all of us, and the call to action for us to make a difference are shared. So let's run into this a little bit. What do we mean by health inequalities? We know this. The World Health Organization talks about the differences between outcomes and health. And those outcome and health differences come from a macro level, across society, investment, ability to have available resources, to have access to care, to the micro, to the local and individual, around, can I actually get to that care? Are there biases against me? Does the care come in the language I speak? Those pronounced differences are particularly of importance to us working in diagnostics because more than 47% of the world population does not have access or has not enough access to life-saving diagnostics. This means practically that today there are 500,000 open positions for clinicians to support diagnostics worldwide with patient impact. More than 1.1 million deaths occur annually due to preventable causes related to 6 key diseases, including diabetes. And as the beginning point on this journey for care continuum from screening and diagnostics to the treatment that pharmaceutical companies can provide, this is an entry point into meeting the needs of patients. But let's talk about the diabetes situation. We in diabetes care articulate our disease space as the epidemic of the 21st century. In the last 20 years, going forward 5 years, we've seen a 51% increase in prevalence in diabetes worldwide, with corresponding impacts to healthcare spend. And the drivers of that growth are not here in beautiful Croatia or in the United States where I'm from. They're often in countries with low to middle income, especially South and Central America, Africa, and Asia. But it's about more than the numbers. We've heard today a few times, and I want to bring it front and center, the necessity for us to put ourselves in the shoes of our patients. So what does this mean for people? Can I ask you all to stand up? Everyone in the room, stand up. Let's talk about health inequalities and diabetes. Everyone on the right-hand side of the room and left-hand side of the room, you represent someone worldwide living with diabetes. Those on my right, sit down. You're not diagnosed. You don't know you have the disease, so you can't begin treatment. Guys on the left, congratulations, you've been diagnosed. We'll pretend everyone's sitting equally. In between the middle 2 sets of lights, if you're in the back half of the room, can you please sit down? You may be diagnosed, but you do not have access today to a standard of care recognized in your country as being good enough. Front quarter, congratulations. You are diagnosed. You have access to care. Everyone who's not in the front 2 rows, sit down. In diabetes today, only 1 in 20 individuals hits target outcomes. That means if this room, if we all have diabetes, only these individuals are hitting their treatment outcomes. That is the challenge we have to face. Thank you, you can sit down. But guys, it's not about finances, and it's not about little icons on a PowerPoint slide. For us in diabetes, it's personal. This is an easy disease to talk about because probably everyone in here has a family member, themselves, a friend or a colleague who has this disease. And those individuals have to make 50 decisions every single day that have an impact on their disease outcomes. But they only get 16 hours with a clinician, on average, per year. The rest of the time, they're left alone to manage a disease that doesn't sleep, and that has human costs. It's the grandfather managing comorbidities who's not living retirement the way he thought because he has neuropathy or retinopathy. It's the mother of a child with type 1 diabetes who does not sleep at night because she's afraid of the adverse event. And it's the child who, up until a few years ago, living in a low-income country, didn't survive to diagnosis, or if they did, didn't make it to 1 year after. We need to address these inequalities in every disease, but particularly in diabetes. And to do so, we see an opportunity. That opportunity for us demands a holistic approach based off innovation, building in digital, and in collaboration with partners. So what does it mean practically? Well, here in Diabetes Care in Roche, we have since 2017 pursued an integrated and personalized approach to diabetes management. For those who don't live my disease space every day, the history of diabetes was one that was very segregated. I had an insulin segment. I had an insulin delivery pump segment. I had a blood glucose measuring segment. I now have a continuous glucose measuring segment. I have analytics for the patients. I've got analytics for the HCP. That doesn't work because none of us can provide all of that to everyone everywhere. And in segments, it doesn't meet the patient need. It doesn't meet the clinician need. And so we have pursued an approach that says through collaboration, through an open ecosystem, through connection, where digital isn't extra, it's not hardware enabling, it's not drug enabling, it's not companion, it's central, it's part of the integrated solution. We offer solutions that meet unmet needs for clinicians and patients. Now, for those of you with a medical background, there's evidence behind this approach, and clearly you need that evidence base to be able to speak the language of those you work with and to demonstrate the value not only for patients and clinicians, but the payer providers that provide us reimbursement. And if we have that, then we can start addressing the stories of halves. And how do we do that? Well, first of all, you absolutely have to improve diagnostics, and you have to improve education. And we do that at a local affiliate level in almost every market, 160 that we play in today. To call out a concrete example where digital's making a difference, in Pakistan, where 1 out of every 4 adults has diabetes, we have launched a #ScreenHer initiative with a local provider that aims to reach 1 million women over the next 3 years to support them in diagnostics and provided support in therapies, both insulin and also meters. When we look at the half that are diagnosed and the difference that change of care, I'm extraordinarily proud of the work we do in collaboration with Novo Nordisk, some of you in the room from that organization, thank you, on changing diabetes in children. This collaboration, built on the principle of global partners, local implementers, and national health ministries, has a simple goal: no child should die from diabetes. And in our partnership, we aim to reach 100,000 of them, focusing mostly on low and middle income countries. There, we use hackathons with the Harvard Business School, School of Public Policy, and local relationships to get sustainable digital solutions and digital registries that meet the needs of patients where they are to increase the likelihood that there is care available and that care has adherence and compliance. And finally, around integrated outcomes that really hit those target therapies, I'd remind you not to make the mistake to assume that all inequalities only happen in some other country. If I measure the inequalities globally and map the spend per patient with diabetes versus the actual number of individuals not diagnosed, the biggest market opportunity by financial value is the United States. So how do you address patients in the diabetes in the United States and in EMEA, where there's a real desire to do more, to use digital to the next level? There are solutions like AccuCheck Insight. So start with the patient need. I, as a person with type 1 diabetes, need to provide the right insulin dose to keep my glucose levels in range. To do so before, I used to have all these separate equipments. Now, in partnership between Dexcom, Diabeloop, and Roche, AccuCheck's our customer brand, I can have continuous monitoring of my levels that is reported to a digital solution that automatically calculates the insulin I need and tells the insulin pump sitting on my body what to do. Practically, that means I've taken the human out of the equation and made it so that through the monitoring system, they're getting the care they need, so they only take intervention when absolutely necessary. Now, why does things like this matter to us? First, for those who are marketers and commercial sides, there's a commercial upside. These kind of integrated therapies now in Europe command a 10 to 20% higher reimbursement than the standalone solutions together. Second, from a medical outcome perspective, as we published in The Lancet, we have measurable improvements. 10 percentage points higher time in range, 50% drop in time with adverse events. That's huge. That means for a person with diabetes on this type of therapy, you have 2 hours back every single day where you're not managing your disease. And that's where it gets personal again. In quotations from patients involved in our study, you hear the emotion behind what a patient-driven approach to addressing needs means. Since I started with AID a year ago, one word: freedom. After 30 years, true relief. And they can just live their lives. Our mission is to bring true relief to patients worldwide, and it's through digital therapies like this, in partnerships and collaborations with national and local organizations, that we make a difference. But we can't do it alone. And diabetes is but one disease. The World Health Organization this year turned 75, with a big mission to bring health coverage to all. And as you think about that, I would challenge you to think about something that's spoken often within Roche, which is life-changing innovation is only meaningful if it reaches those who need it. If you have innovation without impact, you only have invention. And that is not what we are here for. We're here to make a difference. And digital health, as the World Economic Forum called out, has the potential to foster inclusion, to close gaps in care, to provide clinicians with the opportunity to spend more time with patients, and, as we move forward, to enable personalized medicine. So what does it mean from you? Some people will tell you, do as I say, or do as I do. I'll tell you, do as we learned. If you want to make a difference using digital therapies and digital technologies to close the gaps, start by following the data. The data will show you where the problem is. Second, focus on the patient or the clinician. They will tell you what the unmet need is that you need to meet, not the pretty technology, but the need. Tailor it to the community. Know that what works here in Europe may not work in Southeast Asia, and irrespective, what works in a rural environment may not fit for a city. Leverage digital deliberately. It's only a tool. It can be as effective as the problem it's working on, with the right place and the right team with the right intent. Use it wisely. And partner for impact. We would not reach those 100,000 children without Novo. We would not reach those million women in Pakistan without our local partnerships. And as we sit here in a room, we have the capability to make an impact. And I challenge you to seize that moment. Thank you. We've purposely left a decent amount of time for questions because when I work with my pharma colleagues, they always want to ask things about medtech perspective. So if there are any questions, I'm happy to answer them. Mike? Coming from the back of the room.
Great presentation. Can you say a bit more about how your partnership with Novo came about and how you got there? Because there's a lot of potential for these things, but in reality, it's quite hard to get these things to work.
Yeah, so I think the first one to say is the partnership with Novo vastly predates me. And I think more credit goes to Novo than anyone else. Novo came up with the idea that first of all, Novo Nordisk has a triple bottom line approach. That's society, financials, and patients and outcomes, and really wanted to reach those patients in low to middle income countries and children. There's roughly 1.2 million adolescents under 21s. And so the initiative was initially started with a number of countries, and it started with that paradigm of global partner, local country, national ministry, and partnership. Started on a couple countries and got first involved in diagnostics. There was some really fantastic work that was done that they found in their pilots, to use that word. They diagnosed more children with diabetes than we were told existed in a country. I'm not going to name which country. Which shows the unmet need and the disparity in our data today, yeah? And from the success in one country, built to another country and another country. As we work forward today, I think it's been really important to keep the momentum, the local partnerships up, and to use those momentums and exercises like the hackathon I mentioned to bring sustainability to the solution. It's easy for us to swoop in and make an impact and then leave and things don't change. So it's been when local teams have come up with local solutions that they stand by and implement that we've had success. And I think it's been that journey, and it's been a snowball effect. And I think as we've snowballed, we started off, I think, the first year only touching about 10,000 patients, and then it was 30,000 patients, and now it's 40,000 patients. And so it's getting that exponential curve. Any other questions? In that case, I will support us getting slightly back on time and say thank you. Enjoy.